The various components which are used in suspension formulations, I have already told in the last class. The APIs like the raw drugs or other active ingredients, active pharmaceutical ingredients, that means API, which are the active drug substances is used for the dosage forms. Next is weighting agents, then flocculating agents for preparing the flocculating suspension, thickeners for increasing the viscosity, buffers and pH adjusting agents, osmotic agents, coloring agents, preservatives, and external liquid vehicles. The flocculating agents, here in case of flocculating agents, in suspensions, the solid particles are well dispersed in dispersion medium. Therefore, they are called vehicles. The dispersion can be improved by adding the surfactant or protective colloid which acts as flocculating agents. The flocculating agents acts by reducing the flocculating agents acts by reducing the surface tension and thereby improving the dispersion of solids and minimize the flocculation. As examples, sodium lauryl sulfate SLS, twins, that means polysorbate 80, spans and carbovaxis, etc. They are commonly used as the flocculating agents. Then the thickeners and thickening agents. These are the hydrophilic colloids which form colloidal dispersions with water and increases the viscosity of the continuous phase so that the solid particles remain suspended in it for a sufficient long time to measure a uniform accurate dose. They are added to increase the viscosity of suspension, and the flocculating agents, they are added to flocks in the drug particles. The thickening agents used to stabilize suspensions are classified into three major groups. Number one is polysaccharides, number two is inorganic agents, and number three is synthetic compounds. These polysaccharides, inorganic agents, and synthetic compounds are the classification of these thickeners or thickening agents. First, polysaccharides. Two types of polysaccharides are used nowadays. These are natural polysaccharides, and second is semi-synthetic polysaccharides. So natural polysaccharides like gum acacia, tragacanth, starch, sodium alginate. Gum acacia, it is very good protective colloid and suspending agents. It is useful in mixtures containing resinous tinctures. It is more effective when it is used as compound tragacanth powder. Compound tragacanth powder contains acacia 20%, tragacanth 15%, starch 20%, and sucrose. Compound tragacanth powder is used in a concentration of 2 gram per 100 ml of mixture. The compound tragacanth powder is always used when the vehicle is other than water or chloroform water. Acacia contains an enzyme oxidase which causes deterioration of easily oxidizable medicament. So benzoic acid and para-hydroxybenzoic acid are added as antimicrobial agents to preserve the suspension containing gum acacia. Under the natural polysaccharides, tragacanth is there. It is better thickening agents than acacia. It is used as a compound tragacanth powder or tragacanth mucilage to suspend heavy indiffusible substances. Tragacanth mucilage is used when the vehicle is water or chloroform water in the concentration of 1/4 of the volume of the mixture. Then starch is also there. Starch is sometimes used with other suspending agents because of the high viscosity of its mucilage property. It is an ingredient of compound tragacanth powder. Previously, I have also told that compound tragacanth powder, which contains 20% of acacia, 15% of tragacanth, 20% of starch, and sucrose. So, starch is an ingredient of compound tragacanth powder. 20% of starch is used in case of compound tragacanth powder. And fourth one is sodium alginate. It is also a natural polysaccharide. It forms a viscous solution when dissolved in water. Its 1% solution have the same suspending powder as that of tragacanth mucilage. That means the tragacanth mucilage is as same as 1% solution of sodium alginate. Then semi-synthetic. Number one was natural polysaccharides, under which gum acacia, tragacanth starch, and sodium alginate was there. And the number two, semi-synthetic. The following cellulose derivatives are used as thickening agents under semi-synthetic agents like methyl cellulose, sodium carboxymethyl cellulose, or sodium CMC, and microcrystalline cellulose. That means these are cellulose derivatives: methyl cellulose, sodium carboxymethyl cellulose, and microcrystalline cellulose. Now, methyl cellulose, it is generally used in the concentration of 0.5 to 2% as thickening agent, both in external and internal preparation. Sodium carboxymethyl cellulose, it is used in the concentration of 0.25 to 1% for suspending powders in preparations meant for oral, external, and parenteral use. Next, microcrystalline cellulose, so also derivative of cellulose. It is prepared when wood cellulose from wood cellulose by acid hydrolysis. So microcrystalline cellulose is prepared from wood cellulose by acid hydrolysis. It is dispersible in water to produce colloidal dispersion. Next, under thickening agents, first is they are classified into three groups, right? Polysaccharides, I have already told. Next is inorganic salts. Under the inorganic salts, clay is there, aluminum hydroxide is there. So clay, also called bentonite. Bentonite and aluminum magnesium silicate is very commonly used as thickening agents. Bentonite is a very pale buff or creamy hygroscopic powder. A 2% is used for suspending indiffusible solids in external preparation, such as calamine lotion. Aluminum magnesium silicate is a creamy white, colorless, and tasteless powder. It is used as thickening agent both in external and internal preparation. So under clay, bentonite and aluminum magnesium silicate is there, and under inorganic agents, aluminum hydroxide is there. It is used as suspending agents in suspension containing barium sulfate, calamine, sulfonamide, and sulfur. Okay, so polysaccharide is cover, inorganic agents is cover. These are all under thickening agents. That means this thickeners. Thickeners are called thickening agents. So polysaccharides is over, inorganic agents is over. Now synthetic compounds.